Hi, I'm Scott Middleton, CEO of Agape Senior, and today I'm going to talk to you about hospice, or as my mother would say, hospice. She always whispers it, and she does that because I guess people are afraid of that terminology, and they realize that hospice means that somebody's getting ready to die. Now, for my mom, she thinks that means they're going to die tomorrow. As soon as you say the word hospice, usually 2 or 3 days, has somehow got in her mind. But the average person stays on hospice for 6 months. Now, there's many people who stay on, who die very quickly after they've been diagnosed with an illness 2 or 3 days in, but there are others who can be on hospice for 9 months, a year. I think we've had some people who've been on hospice as long as 2 years. Sometimes by providing the hospice services, the extra care that people need will actually give them longer life. In fact, the national statistic is if you get on hospice early enough, you'll live 29 days longer than people with the same diagnosis who don't. But I think you've got to get away from being so scared of that terminology. And sometimes people are even afraid to mention it to their family and their loved ones. But for me, the word hospice, I know one day my children will come to me and say, "Dad, it's time for hospice." And what that does for me, it gives me that time frame of, okay, there's a lot of things I'm going to want to do. And get done. And so I have time for preparation. So if I had a better definition for hospice, I would say it's Advent, which means preparation. So we should be looking for how much time we have to prepare ourselves for the end of our life. And I think everyone deserves that. So I'm going to share with you today some of the key components you should be looking from your hospice provider. And I do want to emphasize the fact that there are choices for hospice. It's not just one hospice out there. Hospice is a service that's reimbursed by Medicare to many different providers out there. In my county alone, there's probably about 10 hospices that are very active in working in our community, but there's probably 40 that are licensed to provide services here. And so I'll share with you today some of the things that you should expect to get from your hospice provider. One of the biggest problems, and maybe one of the biggest advantages, is that hospice really doesn't cost the user anything. Medicare, our government, has made a commitment to make sure that hospice services are going to be available to any patient that actually has need of that, and it'll be paid for 100% by the federal government. And so the option is that you have lots of different hospice providers out there that are seeking to be able to recruit and take care of your loved one, but you will understand that the program pays to the hospice provider a certain daily fee no matter what they do for you. And so, of course, the hospice is, for the most part, financial incentive is for them, the less I do for you, the more money I make. And I will say that in light of whether the hospice is a for-profit or a not-for-profit, they're all having to work within the confines of a budget. And so what you want to know today, what I'm going to share with you, are some of the things that you should expect from your hospice provider. One of the things I think is most important is that there's going to be a certified nursing assistant that will be available to take care of your loved one's needs, helping to bathe or dress or even sometimes prepare light meals, do some light housekeeping. We don't go and run the vacuum cleaner for the most part, but we can help pick up your things and maybe run a load of laundry. So there are a few things that we're able to do as certified nursing assistants in hospice, but there is certain limited amount. What we have discovered over the years is that there, especially in the early stages of hospice care, you may only need somebody to come in once a week, maybe twice a week. By the end of your hospice services, you may need somebody there almost daily. But what we found is that on average, our patients across the board get about 10 hours per patient per week. So some are getting care 7 days a week, some 5, some 3. But don't ever believe that there's a limit as to how much care that can be provided. It all has to be based on a care plan, and it really has to be based on what the assessed needs are. So that's the conversation you're always going to want to have with them. It's not what you want. to have happen. Of course, what we would want is have a nursing assistant there 24 hours a day. Hospice cannot provide that for you, but you'll have to look at that care plan, and you'll have to negotiate that care plan with your hospice provider. And remember, the more the care and time that the hospice is giving to you, the less money they're making back on the profit side of that organization. So it is a negotiation, but we have to be careful too as hospice providers that we don't give you more than what you need, or what's justified based on whatever that care plan says. So certified nursing assistant care and help around the house and with the patient is extremely important. The other thing that probably the most important thing, although maybe that doesn't always look to our hospice patients, but what's the most important thing is what that registered nurse, that case manager, might do for you. You want to have every patient will be assigned a case manager, and one of the things you're going to look is how many other patients does that nurse have to take care of. We found that on average our case managers take care of anywhere plus or minus 15 patients at a time, and those are the nurses that are going to come out and help you with pain management. They may come out once or twice a week. They're only required by law to come out every other week, but generally you want to make sure that that nurse is up to speed about all your healthcare issues and helping to negotiate the kind of care you need, and also be in discussion with your physician about what is appropriate at any level. So you want to make sure you have a good case manager, and also that person is not overburdened with having to take care of too many people. The third thing you want to look at is all the other services that hospice has to offer. Chaplains, social workers who can help you maneuver things like Medicare and Medicaid, but also who can help you deal with some family issues. Many times the onset of death for one family member can create lots of issues and tension and things going on within the family itself. So it's always important that the chaplains and social workers have that opportunity and that they are available. So you want to know what's the availability of those people. Even though you might not need them in the early part, you're going to want to know where they're available. Like at Agape, we have about 30 chaplains that work full-time for our organization, and so even if one is on vacation or out sick, there's always somebody else to cover in those crisis situations. So you want to make sure that the hospice is staffed adequately for all the services. Bereavement services, we continue to follow our patients long after they're dead by working with their families, because so many times there are going to be a lot of family issues related to the death of that person, and we want to make sure that somebody will be there with that bereavement program as well. If your loved one happens to be in an assisted living or skilled nursing facility, you should be aware that hospice is a service that you can select and choose. And you have the option to pick the hospice provider that you would like to have for you in most cases. Skilled nursing facilities can legally limit the number of people who facilities that or hospices that come into their building, but for the most part, most facilities will allow you to select the hospice provider of choice. If you're ever told you can't have hospice, then you probably should be looking for another facility, because hospice is going to be just as important when you're in that assisted living or nursing home as it is when you're home, because most of those facilities aren't staffed to take care, especially of a large number of dying patients, because there's going to be a lot of things that just extra things that need to be done, and that's what hospice is really all about. You also want to look at the volunteer program, because hospice is required to utilize lots of volunteers, and that's always helpful in assisting, just having somebody around for your loved one to talk to, especially if you're busy out there working or got other responsibilities. You want to know that somebody's just sometimes stopping by to talk to mom or dad and to be with them, to do things with them so that they have some activities going on in their life.